Case 77, one of the most compelling crime scenes of the decade. But, was it even a crime?
Anna, she was a very ambitious, lively woman, and she had such a great life ahead of her. But just one day, she was found dead.
What was she like as a child?
She would always put others before herself, and she was such a kind and generous person. Anna was always hardworking.
It was 92 degrees Fahrenheit on a summer morning. The emergency call came in at 9:45 a.m. A man contacted the police to report that he was worried about his next-door neighbor, a woman named Anna Garcia. He informed the police that he had spoken to Anna the previous morning when he saw her walking her dog around 6:30 a.m. He noted that she was wearing a sweater even though they were currently experiencing a heat wave. He decided to call the police this morning because Anna's dog had been barking excitedly for the last 2 hours, which is extremely unusual in this normally quiet suburban neighborhood. He tried to call Anna on the telephone, but no one answered. Next, he tried ringing her doorbell, but there was no answer. The 911 operator notified the local police and the emergency medical technicians. Both the police and the EMT arrived at the scene at 9:56 a.m. The front door had to be broken down. Upon entering the house, they found Anna lying face down in the entry hallway. It was a comfortable 73 degrees Fahrenheit inside the house. The EMT determined that Anna was dead. The police immediately notified your team of crime scene investigators as well as the medical examiner, both of whom were dispatched to the house.
Anna's childhood was not too kind on her. She suffered many diseases and health issues as a child. She had various symptoms in the past that we were aware of.
It dates back to about when Anna was just 4 months old, when her first signs were identified.
When she was first born, she seemed a bit more aggravated than other kids her age. And I thought it was just fine and just ignored it, but it got even worse. She was really pale and wasn't eating all day. And I noticed that her breathing was really heavy and not normal. So my late wife and we were extremely concerned and just immediately rushed her to the emergency room. After running numerous tests, the CBC test results showed that her red blood cell count was abnormally low, while her white blood cell count were elevated. This meant that her body was trying to fight off some sort of invader, and her sickle cell test came out positive, meaning that she had sickle cell anemia. And after her CT scan, we saw that her spleen was abnormally large, and this is called splenic sequestration. And it is when the spleen is enlarged and damaged because of the blockage caused by sickle red blood cells, which is common in people with sickle cell anemia. After she was diagnosed, we gave her short-term treatments such as intravenous hydration and pain medication. We also gave her long-term treatments, red blood cell transfusion, and antibiotics to prevent infections in hopes to help her in the future. She spent most of her life on medications and physical therapies to help her with her painful crises. And one of the short-term drugs was, I remember, it was hydroxyurea. I remember that she often got these side effects while using the drug, where her hair started to fall out and it looked like she had jaundice. The hydroxyurea drug was fairly new at the time and was prescribed to reduce the amount of pain, episodes, and symptoms of acute chest syndrome that she was getting quite often at the time.
I would visit my sister time to time when I finished my homework along with Eric. She used to be so athletic and agile, but just at 22, she was facing problems with her hip. According to the doctors, her hip bone was drying up, causing her joints to collapse. Because the main artery that supplies blood to the bone was blocked due to the sickle cells, I remember hearing about how she needed to go through a hip replacement surgery, and my first thought was hip replacement at that age. Whenever I thought of the hip replacement surgery, I was like, the one that 80-year-olds get after they fall down? I was in shock. Not only to me and the rest of my family, but to Anna as well. But the more Eric and I thought about it, it made sense. In a way, Anna did behave like an 8-year-old at times. She was way less mobile and agile compared to the others her age. Anna had just gotten married at the age of 31 to her best friend since high school, Alex. Marriage was approved on both sides of the family, but the shocker was that they both shared the same last name. They were such a lovely couple, and everything went so smoothly, to a point where they even started considering having a child. Anna had been off of hydroxyurea, so risks of her child having a birth defect wouldn't be as high as if she was on hydroxyurea.
Mother, of course, wasn't too fond of the idea of Anna getting pregnant, as she was still concerned of the birth defects for the child, but also the complications that could arise with Anna's health that could have possibly made her health worse than it already was. Anna called me a few days before Alex and herself went to the genetic counselor to talk about the likelihood of their child being healthy. I remember how she was so nervous and she kept second doubting herself about whether she could go.
Anna and I had just gotten back from the genetic counselor, and I remember how she was extremely intrigued by this new option the counselor had offered us. This option let us look at numerous embryos and pick only one that was free and safe from sickle cell disease and other complications, so that our child's health wouldn't be compromised. I remember how excited and relieved she was about the whole thing, but unfortunately her excitement was lost when the two of us had come to a mutual decision to split our own ways and divorce. After 2 years of being married, Anna and I had still continued to meet up as we were still friends, and I just missed her so much.
My daughter was obviously heartbroken, and everyone was surprised by the sudden and unexpected news. The two were best of friends and seemed to be such a happy couple, but I guess it didn't seem to work out.
Anna not only suffered from sickle cell disease, but diabetes as well. Both diseases mentally and physically affected her lifestyle as she was growing up.
As kids, Anna was someone I always looked up to. I mean, she always tried her best no matter what and never let sickle cell get in her way. Her perseverance, strength, and willpower was admirable.
I remember when she was 10 and we were just 8 and 9. Anna suffered from sudden angina that made it difficult for her to breathe and throbbing within her legs. Mom and Dad freaked out and immediately rushed her to the hospital, taking her out of school. However, on that day, we had our school's annual science fair, and it was her one chance to feel proud of herself, since sickle cell often got in the way of her getting good grades.
Anna, being a strong older sister, she felt that she needed to keep acting strong in front of us, hiding her pain. She would always tell us everything was fine whenever we noticed that she was feeling useless both mentally and physically. We all thought everything would be fine and no other tragedy would occur, yet it all changed when Anna turned 14.
At the age of 14, Anna was a healthy girl with a BMI of 20.1 and a blood pressure of 110/72. But one day, during our monthly checkup, Anna reported having fatigue, not enough energy to complete basic activities, and thirst, frequent urination, and losing around 10 pounds. Hearing these symptoms, my team and I concurred that it was diabetes. However, we performed a glucose tolerance test to confirm this. After the test, lab results showed that glucose levels were still elevated even when the insulin levels still remained low.
Type 1
In order
diabetes
to
is a
maintain
condition
her blood sugar
affected by
levels,
the
we gave her
endocrine
an
system.
insulin
For
pump
patients with
beside
type
her
1 diabetes,
dietitian
their
and
pancreas
to
is
maintain
incapable of
her
producing insulin like non-diabetics.
Diabetics are more prone to infections.
My
which
job as a
spreads
dietitian was to
abnormally
organize a
quickly
healthy
throughout the
nutrition
body
plan
of
and
the
to promote
diabetic.
eating habits
This
that would
usually
help Anna
overwhelms the body
remain
of the
healthy while
diabetic
maintaining
and can
proper
lead
blood
to a
sugar levels
septic
and
shock.
living with diabetes. A sample meal plan would include whole wheat bread, 1/2 cup of shredded wheat cereal, a piece of fruit, and milk for breakfast, cheese and a veggie pita for lunch. It was vital to us that Anna avoided saturated fats, trans fats, sodium, added sugars, and cholesterol, and that she consume more whole grains and protein since she was lacking in those areas regarding her diet.
Despite Anna and her family doing their best to control the effects of diabetes so that Anna could live a somewhat normal life, there were times when her disease got the best of her. It all started on a hot summer day in August, just after halftime.
Come and kick it.
The game was tied 6-6 with 16-year-old Anna the ace being their team's last hope. All pressure focused on winning the game was now focused on Anne, but what they did not know was that she has been feeling dizzy ever since the break before halftime began.
Cute.
To Anna, all this felt strange, since she has eaten a decent meal before the game and took the required amount of insulin, yet she still pulled through for her team. Yet, things got worse, and by the end of the game Anna felt clammy, felt herself and her vision weaken, and felt unconscious. Her teammate then quickly came to help her.
And then,
On her way to the emergency room in an ambulance, Anna experienced painful seizures.
On that day, Anna was hypoglycemic, as confirmed by the symptoms she was experiencing.
It could be returned to normal
Dizziness,
through
clammy
short-term
hands,
rescue
and
methods such
awareness
as
of
taking
vision.
glucagon
It is
or
caused by
taking
low
things
blood
and
sugar
remedies
levels
that are
and is
moderate in
associated with
However, this is not the only one-time thing that has occurred multiple times in Anna's life.
In fact, Anna was not only hypoglycemic at times, but she was also hyperglycemic as well. Hyperglycemia occurs when too much food is consumed, causing blood pressure
Throughout the
levels
years,
to
Anna has
extreme.
learned how to control her glucose levels, but some instances has occurred, such as when she was 25 when she went on vacation and forgot her diabetic supplies. There she consumed multiple foods and high in carbs and sugar. Soon she began making more trips to the restroom and drank more water during the day. On the third day of her vacation, she felt flu-like symptoms and was very confused and disarranged to the point where she baffled her words. In the end, Anna took more insulin and made a trip to the doctor and was treated with IV fluids.
Here she encountered hyperglycemia when she made poor food choices, thus affecting her sugar level. Hyperglycemia can lead to complications affecting your eyes, kidneys, nerves, and heart. Now, if Anna were to ignore her symptoms and if her sugar levels were to continue to rise, soon she would experience ketoacidosis. This is when your body produces high levels of ketones when it cannot produce enough insulin.
Type 1 diabetes and sickle cell anemia were two significant diseases that Anna had. But it didn't end there.
I remember how Anna would always consume food that were high in fat and calories. Another issue was that she would always consume 3 glasses of wine every single day. We were recommended by Anna's primary care physician to have a cardiologist who would give her a cardiac evaluation after experiencing frequent chest pains. Anna told me about her history of predisposed heart disease, hypertension, and her father has experienced a heart attack at just 41 years old. I remember that Anna said that she would do light exercise every day to prevent hypercholesterolemia since she did not want to suffer anymore, but in the end, she seemed to give up anyway. Anyway, when we got there, her EKG showed premature ventricular contractions, while her angiogram showed blocked arteries in her heart. Through this info, she was diagnosed with hypercholesterolemia, and her levels could be controlled by
Anna
diet
had
and exercise to her
atherosclerosis,
cholesterol
a common
levels.
condition resulting from her
But they
inherited
also
disease,
talked about
familial
medication.
hypercholesterolemia. The cardiovascular system is impacted by this condition due to the buildup of plaque in the walls of the arteries. This creates a blockage in the This creates a blockage in the blood vessel, making it more difficult for the heart to pump oxygenated blood to the rest of the body. Atherosclerosis causes blood vessels.
Anna had been on medications and prescribed drugs for the majority of her life. She had been on hydroxyurea to help her sickle cell anemia and was taking insulin to monitor her blood glucose levels, as she was diabetic.
After the autopsy was performed and after her physical examination, it was evident that her death wasn't a homicide or a suicide case, but it was rather a natural death. There was no evidence of post-mortem tampering present, and her rigor mortis was generalized. There was an injury at her upper right temple, including an open wound where pre-mortem bruising was evident. There was no sign of injury around her neck, but her ankles were swollen and signs of edema were positive, showing some moderate fluid accumulation. Her fingernails were graying in color, showing that there was loss of oxygen, and her right proximal humerus and her left distal tibia show signs of a recently healed break or rupture. There were also inflamed red injection sites on her left thigh.
As I was working with the coroner and the medical examiner, we performed numerous interior examinations. First, we started off with the gastrointestinal system. We observed that the mucosa and the
examined Anna's
esophagus
stomach contents
were
and found
intact
about
and
125 milliliters
without
of
any
partially
lesions
digested
or
food in her
injuries.
stomach.
The
There was
gastric,
no
also known
evidence
as
of toxins
stomach
or
mucosa,
poisons
was also
identified.
pink without any signs
After
of
this, we
injury.
had conducted
So
some
the
blood
mucosa
tests
of
and
the
saw
small
no
intestine,
evidence of
the
alcohol
duodenum, elon.
or non-prescription drugs and overdose of prescription drugs. But her blood glucose level was 280 milligrams and deciliters, clearly showing that she was in need to insulin as her blood sugar levels were high. We also conducted an A1C test and results were 11%. Along with this, we found traces of hydroxyurea, which is normally used to treat sickle cell anemia, and evidence of statins, which we predict that she took about 40 milligrams per day. We also ran some urine tests, and the results show no evidence of non-prescription drugs or overdose of prescription drugs. But ketones were indeed present in her urine, and the microalbumin test revealed that there was a significant amount of protein present in her urine.
Diabetes can cause numerous complications, and the kidney is one of the major organs in the urinary system that is impacted.
Sepsis and septic
Its
shocks
ability to
result
filter
from
waste is not
infection,
lost,
including UTIs.
and high blood sugar levels lead to hypertension. Hypertension ruptures and breaks down the filters in the kidneys, meaning that proteins and other nutrients will not be filtered out thoroughly.
In an internal examination, we also saw in an x-ray that she had a pacemaker because she had left ventricular hypertrophy. The left ventricle becomes inflated and enlarges. The mitral valve prolapses, which causes the blood to regurgitate and does not allow for oxygenated blood to flow to the rest of the body.
As a hematologist, my
affecting
job
the
was to
respiratory
observe blood
system.
diseases.
As
My expertise
sepsis
regarding
worsens,
diseases
blood flow
affecting
to the vital
blood range
organs
from
such as
hemophilia,
the heart
leukemia,
becomes impaired.
lymphoma, and sickle
Because
cell
of this, your
anemia.
body has to work
I helped
harder
Anna with
in
the
order to
treatment and
pump
possible
blood,
prevention
which
of
can
other
cause,
diseases
the
that would be
body
caused
to
by
go
sickle
into-
cell. While she was growing up, she became susceptible to numerous infections. This was due to her spleen being damaged by sequestration. A normal spleen protects the human body from infection by filtering bacteria in the blood and reducing antibodies. Yet Anna's spleen was clogged with red blood vessels, making filtering bacteria from the bloodstream almost impossible. Not only did sickle cell make Anna more prone to infection, but diabetes played a large factor as well.
My job was to regulate Anna's metabolism, respiration, growth, and movement. I essentially diagnosed and treated her diabetes. Diabetes, like sickle cell, made Anna more prone to infections because diabetics are at a risk of developing wounds and sores.
Diabetes and sickle cell made Anna's body immune to numerous threats, and considering the fact that she did not take care of herself properly, all the facts add up from the autopsy to what was at the crime scene. Her death was inevitable, but could have been changed if she did something only hours, days, months, and years before to prevent her death from sepsis.
In her very last autopsy, it was found that there was an elevated white blood count of over 15,000 cells in her blood, which indicates
Anna
that her
could
body
have
was
prevented her
fighting off
death from
intruders
sepsis
in the
through
immune
numerous
system.
long and
Along
short-term
with this, they
preventative
discovered
methods.
elevated serum
A long-term
lactate,
preventative
which
method
indicates
would have been
high
staying up to date
fusion
in
and
terms of
hypoxia.
vaccinations,
And lastly,
especially
blood culture
vaccinations
came
that target
out
certain
positive,
types of
which
viruses and
indicates
bacteria
sepsis.
that can lead to sepsis such as meningitis, influenza, and pneumonia. Another long-term preventative method would be for Anna to control her diabetes better through diet, exercise, and taking proper amounts of insulin. Diabetes has a complication where edema can occur in the limbs, resulting in numbness. But if she maintained a strict health regime, she would be more aware of her getting injured as she would be aware of touch. Another long-term preventative method would be taking antibiotics daily to treat or stop potential infections in the future. One more long-term preventative method would be maintaining good hygiene. She could have done this by making sure that she always washed her hands after she touched things that may have had bacteria, risking her immune system. Short-term preventative methods would be going to the ER immediately after she felt the symptoms of fever, mental confusion, difficulty breathing, and fast heart rate. Secondly, taking probiotics, staying hydrated, urinating when needed, and drinking cranberry juice to cure their UTI since ineffective treatment had led to septic shock. Thirdly, Anna should have cared for and cleaned any open wounds by wearing disposable gloves and rinsing with water to remove any bacteria and debris that may have gotten in. After this, it would be vital for her to cover up her wounds. Whenever she noticed that the wounds were infected, containing dust and dirt, she should have gone to the doctor. Finally, Anna should have taken vasopressors to keep her blood pressure high enough to get blood to flow through the organs. This is because during sepsis, low blood pressure occurs and blood cannot flow and bring oxygen to the brain, kidney, heart, and lungs, causing them to fail. The last few moments before Anna's death may have been a painful one. Depending on the severity of the sepsis, her mental state would have been affected, causing dizziness, a factor that made her collide with the lamp and fall to the floor. Pain in the abdomen would occur, leading to a difficulty in breathing. Those last moments must have felt miserable for Anna as she tried to push through and fight back the pain, which was slowly engulfing her as a whole. The pressure of life from a broken relationship to having 3 diseases, constantly acting as a leash around her, may have made death feel like a new escape. In another life, she could live the perfect life she wanted all along. We will always honor Anne, and may her death teach others how to live their life despite not being considered, having hardships. Thank you for joining us on this journey as we close the case on case number 77.